Good morning, everyone. It is Thursday, January 6th. Welcome into the Morning Medical Update. Thank you for joining us here on Facebook and on YouTube. Heading into the holiday season, more than 9 million doses of the COVID-19 vaccine were given to kids ages 5 to 11. And a new report now finds that the side effects from the vaccine were minimal. We've talked about this morning. Pediatrician Dr. Stephen Lauer with the health system is joining us, along with infectious disease director at Children's Mercy, Dr. Angela Myers, will also join us. We will update you on the numbers, the vaccination rate, and what parents need to know and need to do now that kids are back in school. Dr. Stites also joining us again today. Dr. Hawkinson with us. So get your questions sent into us on YouTube, Facebook, and the Medical News Network. You can find links to both of those, all three of those, right there on your screen. But first, let's take a look at the health system numbers. Dr. Hawkinson joining us right now. Good morning. What are those numbers looking like?
Yeah. The numbers are unfortunately increasing even from yesterday. We are close to 100 active inpatients. Right now we have 96 active inpatient infections, 19 of those in the ICU, 11 of those on the ventilator, 37 in that recovery period, a total of 133, but even against the backdrop of the 96, so our number increased for those active infections from yesterday, we should state, Steve, that we had 4 deaths in that 24 hours from the 5th to the 6th at 7 a.m., unfortunately.
That's so tough. This is again, that's a total of, I did the math right there, it's like 143 patients.
Yep,
That's
133, yep.
133 patients. That's a high number, up from 28 to your point, with the 4 deaths in addition. So not the outcome we want to have, but that's the outcome we should know. And as you also saw in the graphic, almost everybody is unvaccinated once again. So it's just tough. It's tough across the United States. You look at the hotspot map in the New York Times, man, the whole country's just shifted to purple. It's done it in a period of weeks, 7 to 10 days. It's gone from a lot of clear spots to just a lot of dark spots and a lot of ink blots all across the United States. And I think that's Omicron, right?
Yeah.
That rapid spread is Omicron. There were some reports coming out of North Kansas City in the wastewater testing that it may be 60% now, Omicron, and so we are seeing that transition here in the area. But I think the reality is that both are going to circulate, Hawkeye. There's going to be this endemic, I think we've had a pandemic, there's going to be an endemic nature to Omicron because it's so different. And there will probably be some delta out there. And so just making vaccination so important, because that's, host immunity will fade, but we can keep you vaccinated, we can keep you safe and out of the hospital, as you can see on our numbers, and out of having to have your family look at you after you passed away. So I think, vaccination is the way forward.
Yeah, absolutely. And I think, if they're both circulating until they get displaced, and, maybe they'll just be displaced by variations of each other, that will likely happen. But just as you said, the vaccinations continue to work, whether it's Delta, whether it's Omicron. If you get fully vaccinated, if you get boosted, you're going to have extreme protection against hospitalization. And if you look at those graphs, either in the New York Times or the Washington Post, you'll see that number of cases is just straight up like we talked about, and it doesn't look like it's peaked yet. The hospitalizations graph also looks like it's continuing to increase. That's the more concerning issue, because we do have to believe that all of those cases that are documented, they're probably not all the cases out there. There are probably more cases than are really confirmed. And so really the hospitalizations is the concerning number. Luckily, it looks like the deaths graphs in those two, either Washington Post or New York Times, looks like it's fairly stable, which is a good thing. But really the hospitalizations are continuing to go up, and we've seen all the problems that are associated overall with that as far as capacity, workforce shortages, and things of that nature.
Any reporters on the line today? All right. Okay, so before we get to, we will get to our many questions that we didn't get to yesterday. We're going to get to those, but I do want to get to today's topic and talk a little bit about some numbers here. So let's go through that. I think. Hold on a second. Okay. Actually, let's just bring in Dr. Lauer. Dr. Lauer, good morning to you, joining us virtually. So glad to have you. He's a pediatrician here at the health system, and also Angela Meyer with Children's Mercy. So many questions that came up yesterday, so I've saved them all for you. How are you both doing today?
So far, so good. Thank you. Good morning.
All right.
Hey, can we make
morning.
fun of Lauer for a minute?
I was wondering who was going to do that.
Yeah,
so
I'm
go
gonna do
ahead.
it.
I'm going to let you do it.
Lauer, can you please straighten the dadgum frames behind you, brother? I mean, they're all crooked and cattywampus. Good Lord.
That's the camera angle.
I
Is
think
that what
they look
that
pretty
is?
good. I thought you were making fun of his
That's
little...
better right there. It's just driving me a little batty like
It's
that.
off a little. Okay, I'll stand there.
Yeah,
Okay.
yeah. It's better when you stand like that. Just cover it all up.
Okay.
Okay,
there we go.
That's better.
Dr. Meyer, I want to start with you. First of all, what are Children's Mercy numbers? People want to know.
Yeah, so our numbers are at the highest they've ever been. We have 35 inpatients this morning, which I know pales in comparison to adult hospitals, but just as a frame of reference, our previous high was a peak of 22 in the peak of the Delta surge this summer. So we are well beyond that at this point.
Yeah, and you guys were at 30 yesterday, I think so, right?
Wow.
And so now you're 35.
We were, and now we're at 35, yes.
Yeah, you're going up and up. As I remember, Jennifer Wassa talked about that yesterday, and you've got a fair number of kids in the ICU with COVID-19.
We do. Again, a higher number than what we've seen previously.
So do we know how many kids in the metro are vaccinated? Is there a way to tell that approximately?
You know, approximately it's around half, just like it is across the nation. For that older, teenage group, that 12 to 15, it's around 50% of kids have been vaccinated. It's smaller than that for that 5 to 11 year age group. It's a much smaller percentage. But we're continuing to vaccinate kids every day, and I know pediatricians are as well. And, obviously we have some exciting news to talk about today related to boosters.
Yeah, that's great news. I think Hawkeye's pretty excited. Aren't you kind of excited about that, Hawk?
I am. I'm anxious about it. Anxious to get my daughter, who is 12, get that boost. So we are going to be getting that today. So I'm happy about that.
Yeah, I asked her. She was sitting outside, and I asked her how she...
Absolutely,
she's
it's great.
so
Now, I
excited.
still believe, she firmly has very good protection, especially these younger kids. We know they develop very good immune responses to that. Overall, they have very good immune responses to the infection. However, we know the benefits of vaccination and boosting as far as quarantine, isolation, all of that kind of stuff. So very excited to get her that boost and that protection today.
I had a friend asking me yesterday on the phone if there's any reason why people should wait, for parents to wait for that age group to get a booster if they feel like they're healthy. I mean, or do you just get it?
Yeah, I think it's important to get it. I think overall what we have seen is that if you get that time away from that second dose, that is when your immune system really has evolved more to be able to complement and get those immune responses to those variants that we haven't seen yet, those variants that haven't even arisen. And so really what this boost does is then help to expand those specific immune responses that have been developing and evolving in that 5 or 6 months from their original doses. So I think that's very important, especially moving forward. We've heard about all of the things with schools, people having to quarantine, people having to stay away from school. If we can do the most beneficial and safe thing to keep the kids in schools, that's what we should be doing, and this is one of those aspects of doing that.
I'm going to bet, Dr. Myers, this has got to be something you're really excited about.
I am really excited about it because there are, a number of kids who were vaccinated last May. And so they are now at that 6-month mark, and let's get them boosted. Both of my kids are in that age group as well. I have one that's almost 18, but one that's only 14. And so this decision yesterday, this recommendation that came from ACIP was really important to me as well.
So, Dr. Lauer, are you hearing this from the parents? I mean, is this something when they talk with you a lot about the clinic? How soon can we get vaccinated? First question. Second question to you is, what kind of vaccine hesitancy are you seeing in parents for kids?
Well, I think there's the large group of parents, excuse me, who are very interested in this and really excited about the option of being able to get their kids boosted, just to do everything they can to be keeping them healthy. There's still, just by the numbers of Dr. Meyer, related to the people who aren't vaccinated and the kids who aren't, there's still a lot of concern out there about, is this safe? Is this the best thing to be doing? And I think as Delta was calming down and things seemed to be getting better, that perhaps we'll just wait and see, maybe we'll put it off for a while, kind of ticked up a little bit. But right now, the answer is the way we get out of this is to get everybody who can be vaccinated or boosted, and provide that protection to keep this from spreading, and trying to cut into that. So the conversations will continue with parents of this is the best, safest thing to do.
You know, there's also an article that came out last night in the New England Journal of Medicine looking at transmissibility and whether or not vaccines decrease the transmission level of at least the Delta. Now, Omicron may be different, but the Delta variant looked like it decreased it by a factor of 2/3. So really, that's good. Now, it waned after a while, again pointing out the importance, Hawkeye, of boosters.
Yeah, absolutely. And I think that is a great point. I think that is a good article. I think with the bulk of the information that we have showing and also understanding the immune system when your antibodies are as high as they can be and they peak out in those 3 months after the vaccine dose, they do contract, they do decrease, but that is our natural immune system. There's nothing to be worried about. That is fully natural. That is what we expect. But in those first 3 months, you have that really heightened antibody response. You have those circulating antibodies that are at those highest levels. That can help reduce transmission. And really the main point of that article, even though they saw reduction in transmission, the main point was it is how far out from that vaccine you are, but that it still works. And so I think now, during this time of extreme transmission and community prevalence, it is very important to build that up. And you will understand that for those 3 months, you will have that maximal protection to hopefully reduce that transmission even more than you would. So I think it is a good time now for those boosters, or to get just vaccinated. If you aren't vaccinated, please just still go get vaccinated.
And I think with Dr. Myers, and you want to keep schools open, it feels like vaccination becomes not only a way of keeping kids healthy, but then decreasing viral transmission inside of school now.
Absolutely. So we do want to keep kids healthy and in school. It's incredibly important, and vaccination is a big piece of that. I would just like to mention that just like in adult hospitals, the kids who are being hospitalized for COVID are unvaccinated. We are not seeing vaccinated kids be hospitalized for COVID-19. And so I think that this needs to continue to be discussed. We need to keep kids in school. We want to decrease transmission risk. We want them to be able to do all the things that they should be doing. And we want to keep them out of the hospital too.
So, Dr. Myers and Dr. Lauer, so there was a report that found about 6 weeks after the vaccine was approved and people started getting the vaccine, about 4,200 cases of adverse effects were being reported. And then they were saying about 98% of those were very, very mild symptoms. When things like that come out, does that help? I mean, help parents reach parents? Because I still have parents that go to school with my kids that are still struggling with this. And so every time these little pieces of information come out, I always wonder if that helps kind of move the needle at all.
Well, we would hope so. This the kind of just the continuing flow of new information, better scientific backed information that shows that the side effects of this vaccine are the ones that we talk about every day for all the vaccines we do. Yes, there's the sore arm. There may be a little bit of a day or two of just not feeling great, but it's really very mild. And the kids who get the vaccine are doing well with it. The side effects are minimal, and they're now protected from ending up in the hospital. I mean, is there a possibility that they'll still get a very mild case? Sure, but we're really protecting them against the chances of hospitalization and death.
Dr. Myers, have you heard anything different?
These side effects, yeah.
No, I haven't. I think that I agree with Dr. Lauer that this information is important and helps add to the data that pediatricians can use to convince people to get vaccinated. That's the key thing here. The most important thing that needs to happen is that we need to make strong recommendations to patients and families, because that's the number one indicator of vaccine acceptance is our strong recommendation.
So, Dr. Lauer, how are you counseling parents, I guess, when they come in? I know Dr. Stites kind of mentioned it. What's it like in clinic? What are you hearing? But, I mean, what are you telling them when they head back out to school? This must keep you up at night a little bit.
Yeah, well, there's just so much stuff that they hear out there, and so much coming at them, and every parent's job is to protect their kid. So we're really just there trying to get these factual answers in front of them, get them to understand that they're doing the right thing by getting their kid vaccinated, by getting themselves vaccinated, and that's how we're going to get out of this pandemic.
All right. Anything else to add? Because I wanted to get to some questions.
We just got a text from
What you got?
Amanda Gardner that, that we have 3 influenza A inpatients today. And so here it comes. This is we said, I would say that Delta and Omicron are a twindemic. This is now a tridemic because we have really Delta, Omicron, and now influenza A. Here it comes. And we knew that it was out there. We knew there was a lot of it, and we knew it could at some point affect us. And we don't, the children will see a lot more influenza in the hospitalization with kids than we will. But those years where we do, I mean, our highest years are 35 or 40 adults with influenza. That's considered a really, really awful, terrible year. Mm-hmm. And we don't need that on top of the 138 Omicron or the COVID patients we have. I don't know. Have you guys been seeing inpatients now with influenza, Dr. Meyer?
Yeah, we've consistently had 3 to 4 kids admitted every day with influenza.
Yeah.
So, that is, we're experiencing this year what we typically would experience with influenza, right? We just didn't last year. It was a weird year.
Well, yeah, put that into perspective, though, for people. When you say you get a text message that says 3 people with influenza A, what does that mean compared to what we've been seeing up until this point?
Well, we didn't have any last year.
No,
I don't think we have a single patient hospitalized with influenza, and now here it comes. And you're like, oh, my God, here it comes again. And, again, think about it, folks. Our hospital has, I don't know how many have anymore, 850 beds or so. Our capacity, we usually run 95% census, right? So if you think about 10% of 8 is 85, and half of that, we usually have about 30 or 40 open beds. And often what happens is by the time the morning rolls around, we don't have any, because the ED sends up a lot of patients, and the ED volumes get high around 2 or 4 o'clock, and then they spike up until about 3 or 4 in the morning, and then things calm down a little bit. But we have these patients holding the ER waiting for discharges so we get more people in. And so, we don't have many beds to play with on a normal day. Now you think COVID. Mm-hmm. We have 133 patients today with COVID. Yeah. Where do they go? Yeah. Right? Where do they go? This is the whole message of yesterday. Where do they go? And now we have 740 or 750 staff out with either COVID or on isolation. So who's going to take care of all those patients? And then you think, okay, yesterday we canceled half of our OR schedule. Mm-hmm. Half. So I mean those are people who need surgery. It's not like these are elective cases that just somebody wants to come get a tummy tuck done. These are people who need real health problems and need an operation. So you stop and you're just like, oh my God, people, you have to help us. Mm-hmm. Political leaders, you have to help us. We can't take care of you unless you take care of us.
Yeah, and I think,
and we usually take care of you. Yeah. Now you have to take care of us. And the way to take care of us so we can take care of you, this is an us and you thing, right? We're actually all in it together. Yeah. The way you could do that is to put your mask on and get vaccinated. That's the only way to do it. Otherwise, this math doesn't work. Yeah. And as you put influenza on top of it, the math just got worse.
Yep. And I know, we're looking to our elected leaders and our officials to help us. Also, you individually have to be doing the most that you can do. Vaccinate. You just said that, Steve. Even though we understand that right now the vaccine isn't a good match for the currently circulating influenza, it still helps. It still has an effect on reducing your chance of that severe disease. And Steve, if you remember way back in March of 2020, there was still high influenza in the United States at that point in time. We had that concern about co-infection with COVID-19, with SARS-CoV-2, and with influenza. That really never materialized. I think there's much higher risk this year of materializing. And I would say that with that brings extreme more risk to you as an individual, because now you have 2 insults on your lungs. We know that with influenza, you do have a higher chance of having something like a staphylococcal or a staph or an MRSA bacterial pneumonia as well, which can increase your risk of severe disease. We don't really see that with COVID so much. We don't really see those co-infections with other bacterial types of things. But certainly with influenza, we know that's a major risk as well. And so you are just setting yourself up for further risk of severe disease. Please go get influenza vaccine. If you haven't yet, there's still time. also continue to get COVID vaccine, just as you said, Steve.
Hey, shout out to Douglas County in Kansas yesterday. Put a mask mandate back in place. Again, we're not politicians, but we know what prevents disease transmission, right? And I bet Dr. Meyer, Dr. Lauer are going to agree with us on that one, right? Well, Dr. Meyer, what do you recommend in the schools as far as masking?
You know, I think as the schools go back this week, they should all be masking. I know that some have chosen to continue to do voluntary masking and have some schools have some parameters in place. If they hit a certain percentage of kids out sick or COVID cases, then they will go to mandatory masking. In my opinion, it's just a better idea to just start the semester off right. Everybody be masked. Let's get through this Omicron surge. Let's continue to vaccinate people and try to keep kids in school, because my concern is that with voluntary masking, kids are going to spread infection very quickly because it's so contagious. And then we're going to have not just kids out, but tons of teachers out. And you can't run a school without teachers and the school staff. So, you know, it's important from both aspects.
And Dr. Lauer, we know mental health of kids. Out of school, not good. Put your mask on so you can stay in school, right?
Absolutely. We certainly learned that lesson at home. If the kids need to be in school, that home is not the place for them to be on a consistent basis with their parents. That just doesn't go so well. So we need them in school. We need them in school being educated. And as Dr. Meyer said, I just don't understand why we would wait for the numbers to go up in the schools. Start off with right from day one with the things we know that work. That's masking, distancing, hand washing, all the things that have worked before. And let's use those tools to get through this, keep kids in school healthy with their teachers healthy as well.
All right, we got a lot of questions coming in fast and furious. Let's get to them. All right, Elena wants to know, how are you handling issues of healthcare workers not on the same page regarding vaccines, whether inside your own organization or outside?
Yeah, we can talk about inside. Outside is harder because that's not inside, obviously. You know, we did really well in our vaccination campaign, guys, and I think that Children's did as well. We can talk to Dr. Meyer just in a moment, but you know, over 95% of our staff are vaccinated. There's a small number that got an exemption, and I think we were down only 0.4% of people left our organization because of our vaccine mandate. That's really good. And again, when you sit down and have conversations with people, and it doesn't hurt they're seeing the result of COVID-19 every single day, then people rally to the facts. And when you see the amount of death and disease being caused by COVID-19 in a hospital, I think that affects people because they say it's real, it's not a hoax. They realize all that internet stuff is just conspiracy junk. And the facts speak for themselves. And so when you see it every day, you live it every day, I think that convinces folks. I think we spent a lot of time with our employees getting them. So we, you know, quite frankly, we did really well around vaccination. Dr. Bruce, I know Children's did really well too.
Yeah, we did do really well around vaccination of our employees, and that's been really great. We've had a number of employees obviously get boosted as well through OC Health, and we've continued to make that available for people. So I've been pleased with the response.
And I think it's just to show, you know, organizations, when they take the time to really meet and talk with folks and tell the facts, that you can get it done. And to be honest, I think most hospitals in Kansas City have done well around vaccination. And now not everybody has mandatory vaccination, but and I know Children's does, we do, and a number of others. But I think that's been, honestly, it was a good journey. And I think it taught us a lot about making sure we are communicating well. And I wish the public could go on that same journey with us. We try to take you on it every day in this program. Mm-hmm.
Dr. Myers, Amy wants to know, what are the age ranges of kids hospitalized with COVID at Children's Mercy?
Yeah, they range it from, you know, really babies, infants under 1 year of age, all the way up through young adulthood.
Dr. Lauer, Angela wants to know, should parents feel comfortable sending kids to school with increased Omicron, masks now optional, lack of vaccines that we're seeing? Should they feel comfortable? I know a lot of people are thinking about going back to virtual learning, but I mean, if kids are masking, should they feel comfortable sending them back?
Well, I think we're probably a long way from comfortable, but I think if parents are doing those things of is my child vaccinated? Are they wearing a mask? Are they doing the things they can do to protect themselves, frankly, regardless of the surroundings they're going into? Then on balance, I think they can feel reasonable about sending their kids to school, knowing the social and mental health benefits that come with that. It's going to be a balance here for a while, but parents and their kids together can do a lot to tip the scales in favor of that being a good decision.
Rebecca wants to know if there's any trials for kids under the age of 5. How soon will vaccines be approved for that age group, are we thinking?
Well, some update just came out this morning that I was looking at in my news feed before this conference, and Pfizer is saying hopefully April. So remember that they decided a third dose was needed for that youngest age group, that under 5, because they didn't have a good enough response to the first 2 doses. So they're getting a third dose 8 weeks after the second, and they think they'll have that data ready to go in April. So fingers crossed, this spring we will have vaccine for younger children.
Where are we with Moderna in kids, young, both adolescent as well as younger?
That's a really good question. And it's funny you asked me that, because my kids are in the Moderna trial, and I called them yesterday to say, what's the deal? Are we doing boosters? Are we not doing boosters? Because, I don't want to get them boosters outside of the trial if you're going to do it, because I want to be good and stay in the trial and help, support the science here. And they are going to start doing boosters here soon. Their expectation is that they will start scheduling people in the next couple of weeks. And so I have a feeling that as they add to that data, they'll be then able to apply for authorization to then get it released for those older kids.
Terry has a question. And I know in the spirit of staying in our lane, trying to take this one on, but what part of the numbers that we're seeing at Children's Mercy, or really anywhere, can this play in convincing schools and governments to go back to requiring masking? I mean, how much weight does that have? What else would be weighted in making those decisions?
So our lane is to talk about healthcare and the impact of the lack of mask mandates on healthcare, and we clearly see it every time we take our masks off. Things get worse. We put the mask back on, the curve gets bent. And so from just our lane, healthcare, masking works. It helps make sure we're open and can take care of all of our patients, and we can do the cases we need to do. Now, there's a toll on society from masking and a lot of questions around that. My only plea to you is this. The calculus right now, to me, is different, because your hospitals have never been at this point of crisis. I've been in medicine for 35 years, never seen anything like this. We're in crisis, and I've never had to say, we just can't take care of everybody right now because we can't get the ORs to run, because we've got to have the beds to take care of all the COVID patients and now influenza. And so the only way for you all to help us with that is to put a mask on. The only way for political leaders to help us is put a mask on. My fear is that as Omicron rips through the population, that the only way you're going to keep businesses open and schools open is to put a mask on. So to me, the things all line up. But, I'll be curious. Dr. Myers, what's your position around some of that?
Absolutely. We need to be wearing masks in public. We need to be wearing masks in schools. We need to continue those careful measures, and we need to be vaccinated. And, my hope is that the political leaders do hear us and do understand that the hospitals are struggling, and that this is the best way to prevent disease.
We heard yesterday, Hawkeye, that 5 times as many people have died in an emergency room waiting for transfer in December as against the month before, any other month. So that's bad news. The average wait time in small towns to get to to get to tertiary coronary care is markedly higher, and so you have to make multiple phone calls. So the stress is everywhere. And before it, you say, well, Western Kansas wasn't feeling it. Yeah, well, Western Kansas is feeling it, folks, as are your metropolitan areas. So when you can't get care, either because A, there are no beds, or B, there's nobody to staff those beds, because both things are true, then the reality is that people suffer, and that's the downstream effect of this. And so, again, COVID's not forever, but masking can really help.
Yeah, absolutely. I think we've kind of talked about this. It's just a matter of what you want to prioritize. Do you want to prioritize the medical data, the science, the evidence-based information to make these decisions, because not all these people that are wanting to be transferred or needing to be transferred because of medical care is for COVID. We've heard this. It is for heart attacks, for strokes, for things like appendicitis, things that would normally be easily treated in the right circumstances when you have that higher level of care that can't. And so that's another real tragedy here.
Beck wants to know, what is the concern level on whether or not schools may have to close? Could we see this happening in the near future based on what we're seeing? Dr. Myers? Dr. Lauer?
Dr. Lauer.
Oof, I hope not. I think it definitely could happen. I hope it doesn't happen. I hope that for schools that don't have a mask mandate in place, they implement it quickly and are able to keep people there and keep schools open and keep moving forward. But I do think that being more proactive is a better idea.
Dr. Lauer, what do you add?
Yep. I'll be a little more negative than Dr. Meyer. I'll say the answer is yes. Schools will close if they go into this without the proper precautions. This is spreading so rapidly, so quickly in kids now too, that the numbers will take off in the schools if they don't do things, and they're going to be in the position of not having either teachers, staff, or students, I think, very quickly. So the encouragement to take the proper precautions right from the beginning.
And just remember, the chain of transmission is kids are going to get it, they're going to take it home,
Yep.
Parents are going to get it, grandparents are going to get it, right? I mean, that's the chain of transmission. So it doesn't end in the school.
And I think it's still going to be, we know that there still is that population out there saying this is just a bad cold, or kids don't get it, kids are okay. We've heard from our pediatricians here, that is an opinion, a full opinion that is uninformed by science, is a myopic view of really what's going on and the reality of what's been going on for the past 20 months as well. And
Yeah, and here's our score. Omicron 133, influenza 3. I think it's a wipeout about which one's worse. What's your score like at Dr. Meyer at Children's? And what's the relative numbers of Omicron and influenza?
So we have 35 in-house today with COVID-19 and 4 influenza patients. Again, we've been seeing 3 to 4 every day with influenza, and that's fairly typical for a normal influenza season. So that doesn't surprise me much. We've seen a big increase in influenza over the last few weeks. So last week, over the New Year's holiday, we had 155 cases, I think, total, not admitted, but total cases that we had test positive. But we have far higher COVID-19 testing positive. So, we used to be around a rate between 10 and 15% of all of our COVID-19 tests would be positive. And now we're up around 30, which is twice as high as we had been in the past for positive cases.
Yeah, 35 to 3. Sounds like a football score.
And I think what that high test positivity rate means is, number one, you aren't doing enough tests, probably because you don't have the capacity and you just overwhelmed. And so that means that there is probably much more out in the community.
So
undiagnosed.
What should parents do about testing? What kind of advice are you giving them? Are they supposed to be taking home tests? How often should they be doing it? Dr. Lauer, where do you send parents and kids?
Well, we're still trying in our setting to get them what we think is still the best test, which is the PCR test. If we can get that run through our system for patients coming into our clinics and EDs, that's what we're trying to do. I think the reality is that home testing is here. People are using it, trying to use it and understand how to use it. I think we're just going to have to work with them of understanding the limitations of those tests, but what negatives and positives mean and how they can be used. So I think it's just going to be part of the evaluation process over the next few weeks to months here.
Dr. Myers, Don wants to know, are kids taking masks off at lunch to eat and even sitting distant without a mask on? Do you think that's still problematic?
Well, yes, I do think it's problematic. I think schools struggle to be able to distance kids enough during lunch. Some schools are better able to do it than others, but you do have to take a mask off to eat. I mean, you can't eat with it on. And schools need to try to do the best they can to try to keep kids separated out. But at this point, if we could get all the kids vaccinated, then the risk would be much lower because they'd be less likely to get infected and then spread it to their friends at lunch, right? So all of these things go together in lockstep, and we need to kind of keep that in mind and keep remembering that.
I'd love to hear from both of you on this because I'm glad Darren is asking, because I personally just took my kid out of gymnastics temporarily. And wanting to know, I have a 10-year-old vaccinated kid, masked, plays trombone at his elementary school, also takes private lessons. Should we just hold off on that for a while? Are we back to that where kids should maybe stay clear of some activities for even just a short time?
Well, I'll say it. What I'm telling parents is everything comes with a risk, and you're going to have to balance these things out. I think my viewpoint would be a group of kids in a small room playing instruments right now seems like a risk. Taking a private lesson with somebody who is across the room and masked, if everybody's vaccinated, probably less of a risk, but nothing's zero. So the hope is that Omicron is a short-lived, relatively process, and by cutting into some of those activities that will help spread it, we can reduce how long it lasts. So some of these extracurriculars are exactly that. They're extras right now, and I think on balance, they should consider strongly limiting those.
Dr. Myers, your advice?
Dr. Lauer is right. Nothing is without risk. And we have seen that the physical fitness level of children during this pandemic has gone way down. And, that's also not good. And we have an obesity problem in the United States. So we really have to balance this. I agree that there's some things that are higher risk and some things that are lower risk. And sports where you're crowded together in a group, you're wrestling, that's a high risk sport. And we went through this previously where, sports were kind of categorized into high risk and low risk. I agree that the playing in instruments in a room together tightly packed is high risk. So I think we have to take a look at each individual activity and kind of categorize it into kind of a high, medium, and low risk, what your risk tolerance is as a parent. Is your child vaccinated or not? Are the people they're around or people they're playing with vaccinated or not? And I think all of those factors go into that decision making. But I think where possible, when you can make it a low risk situation, we need to keep our kids physically active because that's a major problem in our country right now.
I have a couple of booster questions I need to get to. Patricia, I promised I would answer your question. So she's concerned. What protection do I still have if I'm 6 months out from my Pfizer booster? Do I still have any protection left? Will there be a fourth booster on its way?
Well, there is going to be, I think, a fourth booster on
Or a
the
fourth
way,
shot.
and I wouldn't be surprised to hear that in the near future, actually. But I think that the answer is, Hawkeye, both B cell and T cell immunity. Even though your B cells may not be producing all the antibodies, you still have pretty good T cell immunity. It does wane, but there still is protection.
Yep.
The question is, you made the commitment to go ahead and getting your first series of shots. Why not keep getting that next series of shots in order that you maintain the highest level of your of protection available?
Yeah, I mean, right now there is no overall guidance for getting a fourth dose. We know Israel, in certain populations, I think, has gone to a fourth dose. But I would feel confident, and you should feel confident, that after that boost, especially if it was 5 or 6 months out from that second dose, again, in that time is when your immune system is really evolving to identify those variants that we haven't even seen. And that's what we see with that boost, because now after that boost, we see that those antibodies, those neutralizing antibodies to Omicron are extremely high. So we know that there are other antibodies that aren't tested that are extremely high as well. To answer your question, you still have very excellent protection against hospitalization, severe disease, and death, even 6 months out from that booster dose. So I think you should feel confident that you are well protected. You may not be as well protected against just getting the infection, but you are well protected against going to the hospital, going to the ICU, and dying, even 6 months out from that booster dose.
Yeah, we did see the beginning of some waning of that immunity at 6 months. And we know, for example, the patients who are hospitalized in our institution that have been vaccinated tend to have been people who have not been boosted. And so the boosted folks are the ones who really don't come into the hospital And then vaccination of any sort has been protecting you from coming into the ICU or death. And so I think it's the story of how much immunity you need. And again, folks, remember, we are still building this airplane while we fly it, and whereas we're really a lot better at it, it's a struggle. And people get frustrated because they think that just means science is wrong. What's happening right now has never happened before, which is that science is pushing out data, and everybody can see the data and make the interpretation for it by themselves. And that's just not that. Normally, the debate occurs. Yeah. There's lots of study. There's lots of evidence. There's lots of clinical trials. Then we can come out with a really informed opinion. But instead, what's happened because of the immensity and the critical nature of this crisis, what's happened is all the information's gotten pushed out from the moment it gets ready. I mean, we get press releases long before it ever goes out into the public or into the scientific domain. And so you're getting stuff so much fresher. You're getting it generations ahead of where it was really meant to come. And the point of saying that is that's the reason sometimes it feels confusing, is the debates going on in the public forum as opposed to scientific things, which most folks never pay attention to. You ever go to these scientific meetings? Like we got Hawkeye, I'm sure all this group on here, we all go to scientific meetings. You stand up and listen to these people debate, and they fight and they argue with each other for hours on end. Sometimes they can be pretty darn self-righteous about it too. They get up on those stage and they fight back and forth, and we all listen to it, but that's the nature of the debate. No one ever goes to that, but goofy nerds like me or Hawkeye. Well, maybe Hawkeye's not a nerd, but Lauer is, and so we go to that stuff and you listen, and then you kind of form your opinion. Now that debate's taken center stage. Everybody's hearing it from the moment it comes out, and so people all form their opinions. But that's why we say we're building the airplane while we fly it, because normally you wouldn't see the plane until it was all the way built and ready to go. Now you're on the ride. And that's the difference. That's why it feels like a roller coaster.
But don't leave anyone out. You're all nerds. You know that.
Okay, I'm not calling Dr. Myers a nerd.
Definitely not Dr. Myers.
And I'm
She's
not calling
cool.
you a nerd.
I won't leave you out.
Anthony
Yeah, we won't
nerds.
leave you
They're
out.
back
You're a
there.
nerd too.
Nerds there.
All right. Live long and prosper. Star Trek Discovery, baby.
All right. Yeah. Dr. Myers and I, we're cool. We try to be cool, right? Cool moms. Okay.
Yeah, whatever.
Oh,
You
stop
guys
it.
are hip. Yep.
Or hip, which is a totally uncool word, I know. So,
Okay. Now you're a nerd.
Right. So, a couple quick questions. Tom wants to know, Dr. Hawkinson, I know you're getting your daughter boosted after
Yeah.
the show today. Did you get your son boosted, or are you going to?
Yes. Oh, absolutely. The word is yes. I just didn't work out with the schedule today as with my daughter. So, absolutely.
Millie has a question. Dr. Myers, any known side effects from vaccine causing myocarditis in 5-year-olds?
Yeah, so that data looks like there were a few cases that were reported, really rare. There were no cases of it reported in Israel, though, which was interesting. I was looking at that data yesterday. So it's a much more rare condition the younger in age you get. It's far more common, not related to COVID vaccine, just more common in general from other viruses in the older teenage and young adult population. So it's not surprising that there were a few cases reported, but that it was even more rare, if that's a right term, than it was to begin with.
One last question, just since we have you here, Dr. Myers. Someone's just curious because they're trying to find a way to get their under 5-year-old more protected. Are there any studies or trials going on that they could participate in?
I don't know if there are any that are enrolling new patients at this point. The trials here, at least in Kansas City and at Children's Mercy, are getting ready to, do the third dose for those younger kids. It's worth calling around and asking different places to see if they have any ongoing that are enrolling to, start the trial. But I know that we don't here. We've already enrolled all of our people in that Pfizer younger age trial.
And just lastly, Becky wants to know if Children's Mercy offers any monoclonal infusions that work against Omicron.
So this is a great topic and probably one that could take us a while to discuss. So recall that there was only one monoclonal antibody available for young children under the age of 12, and that is the combination drug. That's the Eli Lilly product. That's the BAM-EDI is what we're calling it for short. And then for the older people, you could get, Regenco, the other drug. And at this point, neither one of those are effective against Omicron. There is another monoclonal antibody that is effective against Omicron, but by and large, the adult hospitals are being prioritized for that. So we have been allotted a few doses of that. I don't believe we've received them yet, but this is an ongoing issue because so many people are needing it, and relative to adult hospitals, we don't need nearly as much. And so this is something that's playing out in real time, just as was mentioned, the plane is being built as we're flying it, and we are doing our best to try to get the new monoclonal on board, get it ready, and be able to give it to kids as we see Omicron taking over.
And I think she brought up a good point too. Angela, please correct me, but she said there was really only one that is authorized for under 12. Most all the other ones are really 12 and up.
All right.
Yeah, that's correct. And the one that's authorized under 12 really doesn't work well against Omicron. So we will probably stop using it here pretty soon.
All right, this has been a great conversation. I know all four of you have to get back to work, get to patients. So we're going to get to our final thoughts. And Dr. Lauer, get us started.
And the thought I want to leave with is what I don't want to see us be in is a position 3 or 4 months from now, we're going like, well, we're done with Omicron, we're done, and we're right back into this again. The answer across the board remains in a situation where we still only have 60% of people vaccinated. We've got to get people vaccinated across the board. That's kids, adults, everybody who can be vaccinated. It's our way out of this. Masking and all those other ones we need to keep doing that, but the long-term and short-term solution to most of these problems, if we want to avoid this conversation down the road, is get vaccinated now.
Dr. Myers.
I completely agree with Dr. Lauer. We need everybody to be vaccinated. We need everybody to mask when they're in indoor settings, when they're in school, and things of that nature. And, we really need to listen to our public health experts. We've, not had to do that much prior to this pandemic because we didn't have any reason to really have them out forefront and have them giving us the guidance of what we need to be doing to stay safe. And so people got out of the habit of it. And we really need to be listening to our public health experts at this point.
Thank you both for joining us virtually today and answering all these great questions from our community. Dr. Hawkinson, final thoughts?
Yeah, if you've had your boost, you are safe. Even if you are 6 months out, you still have good protection. It has good efficacy against hospitalization, severe disease, and death, so take comfort in knowing that. We really want these vaccines to be approved for those under 5. I know my 6-year-old nephew has gotten both of his. Unfortunately, his brother, who is 4, Josh, has not, and he just recently had to be now out and quarantined from his daycare because somebody in his daycare had it. There are other kids who are 5 years old that were able to continue to go there because they are vaccinated, but he's missed out on that experience and socialization and all that. So it is vitally important that if your children are eligible, please get them vaccinated. And we certainly are waiting for that approval for those under 5 as well.
Our favorite nerd, what do you have to say?
Yeah. So here's my thought for the day, guys. First of all, so proud of the team that is here today and all the people who worked so hard yesterday, today, every day to put this together. And thanks to Dr. Myers and Dr. Lauer for joining us. Very happy that this great relationship between K and Children's allows us to continue to have this terrific conversation with our public. Here's my thought for the day, folks. Give grace, find courage. The grace to have this conversation and to be honest with each other and to try and make sure that even when we're wrong, we're all trying to do the right thing. But then find courage to make sure that you listen to the news and you listen to the public health officials that really have spent their entire lives studying this and not the stuff out there that are people who don't really know. And you have to make the decision. I got to find the courage to do the right thing and listen to the people who really know this topic as opposed to those who just want to talk about it. And that's a big difference, right? That's a big difference. So let's give grace so we can have the conversation, but find the courage to listen to those who really know.
Love it. Great message. All right, everyone, thank you so much for being with us today. Don't forget, you can catch our shows anytime on Facebook and our YouTube channel. Tomorrow, we are back at it with Follow Up Friday. Both Dr. Stites and Dr. Hawkinson are going to be here to get to some of those questions we couldn't get to earlier in the week. So bring your additional questions tomorrow. We will see you at 8 o'clock. We're going to have some fun with Dr. Stites. We'll tell you about that.
Wait, what?
Coming up tomorrow. Make it a great Thursday. You don't get to know. You don't get to know everything. Have a good one.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.